My name is Dr. Elizabeth Connors, and I'm the training director for our Yale Doctoral Internship in Clinical and Community Psychology here in the School of Medicine. Our program aims to attract the most talented and compassionate next generation of future psychologists. Each year, we admit up to 14 psychology fellows who are entering the final year of a clinical, counseling, or clinical and community degree program. The goals of our program are to support each individual fellow on their personal trajectory toward becoming an independent psychologist.
I immediately was drawn to Yale's program. I like the fact that it has an emphasis on community-based work. There was a variety of different settings, different populations. You're really able to pick your own adventure and grow as a person professionally and personally.
Our internship program is a year-long intensive clinical experience.
While the foundation of our clinical psychology internship program is, of course, world-class clinical care, our fellows also have the opportunity to train with a variety of other activities that are important to psychologists, such as assessment, diagnosis, prevention, consultation, and program evaluation. Our program embraces a scientist-practitioner model, which means that we leverage theory and evidence in the care we provide, and we also leverage practice-based evidence for our research and scholarship. We offer 10 placements across 2 clinical institutions, the Connecticut Mental Health Center and the Yale New Haven Hospital. We have inpatient, outpatient, and community-based programs, including community-embedded programs in some of our satellite clinics in Greater New Haven.
We have 5 interns that come to Yale New Haven each year. And of those 5, I directly supervise 2 of them.
There's such a broad range of different important skills that we develop, so we work together in treatment planning, working with medical teams, not only in the evaluation stage, but checking in with physicians, letting them know how patients are doing. Coordinating care has been a huge part of what we do.
We're always trying to enhance or develop what we're doing, and much of the changes come from the feedback that we have from interns and their efforts to help us develop new programs.
I think a big part of my own training goals is I wanted to work with different people in different parts of their recovery. And so at CMHC, I'm working with people who've been there for like 15, 10, or even like 1 year. And then same thing with like inpatient as well, people who just got admitted or also who've been there for a couple years. And so I really appreciated that diversity of work.
My primary placement rotation is the substance abuse treatment unit. It's been a really awesome interdisciplinary experience. I use a variety of approaches from cognitive behavioral therapy to acceptance and commitment therapy, and I'm currently getting more training in psychodynamic psychotherapy.
We have what we consider a junior colleague model. We know and recognize that they also have something to teach us.
The thing I find most inspiring are the fellows themselves that bring just an endless array of life experiences. So it's a real joy to get to teach our trainees and learn from them.
The supervising that I do is within a research context, so I tend to be mentors on a scholarly project.
I work closely with community coalitions, community systems with a lot of different stakeholders, and I like to do that with students.
Most of our fellows go on after graduation to postdoctoral fellowships in academic medical centers or health organizations. However, a number of our fellows also go straight to independent private practice, faculty roles, policy, or public service leadership positions. We actually have been able to recruit and retain many of our psychology predoctoral fellows to postdoctoral fellowships right here at Yale. It's always a joy when we can actually keep them a little bit longer to advance their career and to support them along the way.
I've been out at Yale for over 30 years. I came here to train. I was trained in clinical and community psychology.
I've been here my entire career. I was actually an intern here in 1991. I was so drawn to the type of work that was going on here. I knew that it was a place of excellent clinical care, and I knew that the reputation of the faculty was phenomenal. They were experts in the field.
A number of our training faculty, including some of our newest assistant professors, were actually fellows here in the program. and were able to stay on with us.
So I trained at the Substance Abuse Treatment Unit primarily, and then the Consultation Center secondarily. I actually applied for an F-32 postdoctoral grant for 3 years. So I'll be doing secondary analysis on clinical trials data, specific alcohol to Alaska Native peoples.
New Haven is wonderful for a variety of different reasons. There's so many different cultures that are here just in this city, let alone the state of Connecticut. That presents itself in the ways that communities show up, the different activities that are around that you can participate in.
Connecticut coast is gorgeous. There's terrific food, very good music, great theater, and nice people in our community.
Yale is a very supportive place. It's collaborative.
You can focus on whatever area that's important to you.
If there is or there was something that I wanted to learn, it's available. There are very unique individuals here.
I've been a training faculty member with the Yale Doctoral Internship program for 6 years, and it's such an honor now to lead this program as training director, because my favorite thing is working alongside our outstanding fellows and faculty to advance innovation in psychology and leadership in all the specialty areas that our program represents.